Inside your brain, there's a special fluid called cerebrospinal fluid. And when a jelly-like cyst blocks its flow, your brain can literally start filling up with the fluid. And the symptoms? Headaches, nausea, memory loss, and if it's not treated in time, it can even lead to sudden death. This colloid cyst is generally very slow growing. It's not cancerous. Nearly 99% of these colloid cysts are actually found in the third ventricle. Most patients diagnosed with colloid cysts are between 30 and 70 years of age. Since the colloid cysts most commonly occur in the third ventricle, as they grow in size, they can obstruct the flow of CSF, and this leads to ballooning of the lateral ventricle. The colloid cyst acts like a ball valve, stopping the flow of CSF from the lateral ventricle to the third ventricle. How is the third ventricular colloid cyst diagnosed? It is usually done on a CT and MRI. Now let's focus on the third ventricular colloid cyst. So like we said, it is a cyst that is present in the third ventricle, preventing the flow of CSF from the lateral ventricles into the third ventricle. And as this cyst grows in size, it starts causing obstruction to the flow of CSF. So what are the symptoms of third ventricular colloid cyst? There is one group of symptoms which are caused because of increased fluid pressure within the brain, like headache, nausea or vomiting, blurred vision, tinnitus, which is sound in the ear, or giddiness and imbalance. One or more of these symptoms may be present. The second set of symptoms are because of pressure on important structures around the growing or enlarging cyst, like memory issues, forgetfulness, confusion, difficulty in walking, or brief loss of consciousness, or coma. The greatest and most serious risk of the third ventricular colloid cyst is sudden death, which is why it is important to diagnose it in time and act upon it in time. Importantly, what the viewer must remember is, if the third ventricular colloid cyst is removed completely and successfully, the individual has the potential to lead a completely normal life in future.